General Granger, thank you again for meeting with us. As a fellow veteran, first of all, thank you for your service. Your CV is like nothing we've ever seen before, and I'm honored to truly call you a friend and a colleague. You're joining First Health Advisory here as we are seeing a time of regulatory and policy movement in the healthcare industry. What really is the driving reason for you coming to joining our board here at First Health Advisory?
Well, first of all, I think one of the critical pieces when we look at healthcare and other industries is making sure that our communication systems, our devices, all those things are secure, because we're in an environment that's ever being tacked. Either your communication systems, your devices, whatever means you use to, or media you use to, is being under attack by outside forces. And sometime when those outside forces attack, they attack from several ways. Number one, they'll attack what I call the people, getting into their email systems. Number two, they'll attack our processors, our IT systems, our communication systems. And number three, they'll attack some of the software or blocking and tackling software we have in place designed to prevent them getting in. They'll figure out how to attack that also. The fourth thing they will do, they'll mess with what I call our productivity. Once they attack a system, that system is actually locked down, or they get in, they'll lock it down for you without your permission. And then they'll say, pay me or give me this, dollars, Bitcoins, whatever currency they want to communicate in. And the last thing, I call it the price. They make it very costly for you to be able to operate unless you communicate and cooperate what they're asking for. Another reason it's important we do this too is because if we don't have these communication systems, these devices up and running, it makes us inaccessible, number one. Number two, it affects with our 7/24 operation and customer service. It knocks out our quality of our system and trust in our system. And the last thing, it affects with our utilization management of our systems or devices, and it keeps us at increased risk and decrease our trust for our end users, our customers. And the most important, you look at what we do as an advisory board, as a company, we bring value and we're always relevant based on the ever changing things that's happening in security from a cyber standpoint. That's my rationale.
That feeds right into that risk assurance of First Health Advisory, and you're exactly right. Former tacticians, we sit here and look at how the enemy can attack, and now it's translating it into the healthcare sector as now retirees through your remarkable and dedicated public service, years serving the military and overseeing TRICARE and DoD, the managed care program within the MHS or military health system. How do you see your experiences and skills shaping the vision for the board for First Health Advisory?
Well, first of all, a good question, Brad. I see it in several ways. Number one, and I'll describe it in the 5 Ps. The first thing, from a people standpoint, I served in that system for over almost 38 years, number one. Number two, from a people standpoint, we have individuals, when you look at the Defense Health Agency or Health Affairs or Department of Veteran Affairs, whatever federal agencies that's involved with the military or veterans, they put in an enormous amount of sacrifice in serving their country as well as their families and survivors. We want to make sure their information, how they operate day to day, and how they get their health care is protected. Because nothing is more precious than your personal health information. The second piece is that since I've grown up in that system and I still work indirectly in that system, I don't want nothing impact their processes, how they operate. They operate 7/24, 365. They operate globally. The military healthcare system never goes to sleep. The sun is always up in some part of the healthcare system in the world where men and women, as well as DoD civilians and contractors, are serving. So I want to make sure their processes are protected. The third thing I want to do is making sure that We bring to them the best preventative things we can to help protect their healthcare system and communication and devices. We want to do it in a very proactive way. It's okay to react after it happened. We want to prevent it from happening. The fourth thing is from a productivity standpoint. If any of the military healthcare systems or the defense health agency system goes down, it's almost make them almost non-operational. Can they go back to paper and other means of communication? Yes, but that's very difficult. We have a generation of individuals in the military healthcare system or the defense health agency. They have never trained writing on a piece of paper, writing out a clinical note or what we call subjective objective assessment. What is your plan? So never. Nor have they written a prescription using a prescription pad. Everything's been electronically. So from a productivity, it would make them totally almost inefficient to the point that we probably have to stop certain operative procedures, certain diagnostics, whether it be X-ray, MRI, and especially from a pharmacy standpoint. All those systems work on system. The last P, I call it price. It would make it very cost ineffective and in some cases cost prohibitive. If that system went down, it'd be more than what we want to do in terms of cost, what it costs to get it up and running. Another important point that everything they do day in and day out has value to all the way up to the national defense authorization. What is the national defense strategy based on the White House and all the agencies? It would impact what's DOD from a healthcare perspective role in a national defense strategy. It would impact that significantly. Okay.
I
And
think
last but
that's
not least, at the bottom line, it'll impact, can we provide healthcare?
and to that exact point, sir, I find it very interesting as we see the military health system move from a government off-the-shelf system to, in the old CHCS, Alta, CPRS, Vista, moving now to that more commercial model, seeing how we are integrating more of a commercial framework, if you will. The security of the DoD is a microcosm of the greater United States and the overall healthcare. So if we can help secure national security through the military health system, we are also establishing a framework to be able to take care of the commercial health system as well.
Absolutely. And that's a great point, Brad, because our new electronic healthcare record for the Department of Defense and the Department of Veteran Affairs or the Defense Health Agency or the Veteran Health Administration is very similar to a lot of commercial healthcare, electronic healthcare records, because we took it an off-the-shelf product, we added and modified to fit our environments. But at the same time, we showed them that this is how we secure it at a totally different level from what they secure. We can share those lessons learned to the commercial side and also protect our commercial systems from a healthcare perspective. Because the way the bad guys are acting now, they're hitting education systems, they're hitting small rural healthcare systems. If we can give them some lessons learned and some tools using our advisory board and our board and everything's expertise, that would add a lot of value because right now we have all these what we call critical access hospitals. And if we can show them these are the tools we've developed for DOD, Department of Defense, and Department of Veteran Affairs, and the military healthcare system, then we can share some of those tools with them to help protect their system. Because a good part of healthcare takes place in rural America, number one. And a lot of our camp bases and stations are located in significant parts of rural America. So we can share those lessons learned using our advisory and our expertise. That makes all the difference in the world from an electronic healthcare record, especially one that we have now.
It's almost like it's the cyber social determinants of health, and truly in those underserved populations. Absolutely, sir. And that's really where our focus is. And I guess to wrap us up, sir, what are you most looking forward to as being a part of First Health Advisory Board?
I look at most important working with a team of brilliant individuals from all walks of life and all background, all industry, number one. Number two, putting our collective thoughts and ideals and going out and making a difference with the company's expertise. And number three, try to set some legacies and standards that others can follow. especially when it comes down to our critical access hospitals and rural hospitals. And last but not least, I want to be able to help us with my policy experience with TRICARE, the Military Health Insurance Plan, Defense Health Agency. I want to take some of my policy experience and try to help them influence that at the national level, Congress and other areas that I have, expertise and have influence with the rest of the board members as well. That's what I see my role.
That is fantastic, sir. And I cannot thank you more for joining our team. Again, I've had the privilege to meet with you multiple times. I'm excited for our future together, sir.
Well, look, same here, Brad. I would say this. We have one mission. We have one team. We have one way of protecting and defending what we try to do, infrastructure from cyber attacks and securing them.
Cool, sir.